I'm a hip surgeon and over 60% of my patients are women. Many of them are struggling through the menopause. It's bad enough dealing with the hot flushes, poor sleep and irritability. But when your hips play up, it's often the last straw. Just this week I saw someone who's right in the thick of it, which is why I wanted to talk today about the relationship between inflammation, the menopause and hip pain. Keep watching and I'll tell you all about it. Our bodies are truly amazing. When you look into the way everything works and keeps us alive, the more incredible it seems. Let's look at the immune system and inflammation. We're constantly under attack from bacteria, viruses, allergens, rogue cells and pollution. The immune system monitors what's going on, ready at a moment's notice to attack. It's like a war room. One of the weapons it uses is inflammation. This is a complex biological process that the body initiates and regulates in response to harmful stimuli. Proteins and cells cause the blood supply to increase, and we experience heat, redness, swelling and pain. As the inflammation subsides, tissue repair and regeneration mechanisms are activated. These replace damaged tissue and restore function. Acute inflammation is a protective and essential response to injury and infection. But as we get older, the immune system does too. It isn't as efficient. It can sometimes go a bit rogue and start damaging us. We can develop chronic inflammation, and that's associated with things like heart disease, diabetes and Alzheimer's. As you can imagine, there's a huge amount of research going into the effects of aging on the immune system. So let's talk about the menopause. The menopause is a natural biological process that occurs in women typically between the ages of 45 and 55. During the menopause, a woman's body undergoes significant hormonal changes, particularly a really steep decline in estrogen and progesterone. This is where things get interesting. These hormonal changes during the menopause can cause chronic, low-grade inflammation. This affects various parts of the body, particularly the joints and muscles. Bones become thinner and weaker, that's called osteoporosis, and muscles lose their tone and power. There are changes in metabolism, including weight gain and alterations in fat distribution. Fat tissue, particularly abdominal fat, can produce inflammatory substances that just fuel the fire. Tendons and ligaments get weaker and they start to tear. Joints become stiff and painful. Pain at the top of the thigh is something I see a lot. It's often associated with back pain, and inflammation might well be a part of these problems. It's important to know that the relationship between the menopause and inflammation is complicated. It's not the same for everybody. Not all women will experience significant inflammation during the menopause. It's definitely affected by genetic factors, so blame your mother, and things like diet, exercise, smoking, alcohol and stress. So what can you do if you have hip pain during the menopause? Well, here are some tips. We are what we eat, so make sure that you have a diet that's rich in fruit, vegetables, whole grains and healthy fats. Carbs and ultra-processed foods are definitely worth avoiding. Regular physical activity to help reduce inflammation and strengthen the muscles is really important, particularly around your hips. Walking, using the stairs and keeping moving are things that are easy to do in everyday life. The more you do, the better you'll feel. It's good for the mind as well. Try to keep your weight under control. Losing the pounds reduces stress on your hip joints and it makes you feel good and helps to reduce inflammation. Chronic stress can cause inflammation, so try to do things like meditation or yoga. Cutting back on booze will help you to sleep better, reduce stress and anxiety. Stop smoking today. Supplements can be helpful, but I'll talk about these in another video as they're a huge topic. If you've tried all these things and you're still struggling, it's time to ask for help. I know it's not always easy to get to see a GP these days, but this should be your first port of call. Many practices run women's health clinics that give advice about managing the menopause, including the use of HRT. If things really aren't getting any better, then think about seeing a specialist. An orthopedic surgeon like me will assess you, make a diagnosis and recommend treatment for your painful joints. I work with a team of physios, nutritionists and specialists in medical management of the menopause. Together we'll get you through this difficult time. Inflammation, the menopause and hip pain are all interconnected. If you understand this relationship, this can empower you to take control of your health. We're all different, so there's no one size that fits all solution. If you'd like to know more about what I've talked about in this video, or anything to do with hips, then just get in touch. The details are below in the description. Thanks for watching. See you all again next time.